So every ounce of fat that he took out of me, he stuffed in my body. Because he didn't want to throw it out because he said it's too much of a hassle to throw out.
When I was about 14 or 15, I fell off my bike, straight into the curb.
Ouch.
And was your nose crooked?
The wee bit here, yeah. And then I started to snore and having breathing problems. And then I went to a surgeon. I was about 18, I think. He said to me that he thought my nose was very manly and he could define it and, you know, give me like this lovely nose.
And
so
he suggested these
He
changes.
said this to me.
You walked into this plastic surgeon's office with complaints of breathing.
Yep, he says he thought that he could fix my nose.
Red flag.
When my plaster came off, I actually was happy enough with it. And the surgeon wasn't happy with it. I said my nostrils were too big and that he wanted to make them smaller.
That's twice.
Yeah, so again, I went with him.
How long was that between the first and second surgery?
I think it was about a year and a half. When the surgery was finished, my nose was all pushed over and apparently it was like some sort of blood clot or hematoma or whatever.
On the skin or inside?
No, inside. But when he tried to fix it, when the plaster came off, there was no difference.
Well, I know it's affected her so much. She said to me, I feel deformed.
Wow.
I feel like a freak. All I do is think about what other people are thinking of me. I've been robbed of my confidence, my looks, and a wee bit of my personality.
You just wanted normal again.
Yeah, it would just really help my life, I think. Before my surgery, my nose was deformed and I felt like I looked like a freak. My nostrils were uneven, I couldn't breathe, and I felt extreme anxiety when I would meet new people. But now, thanks to Dr. Nassif, my nostrils are the same size, I can breathe properly, and my anxiety is gone.
So what I'd like to know is, tell us when this all started. Give us a little history behind everything.
Well, I come from a long line of beautiful women. All have a hump on their nose. This is what God had to work with. Okay. But I don't feel like it was nearly as prominent on their face because their face is just shaped differently.
Right.
So you had a bump, a hump.
Yes, exactly. Huge bump.
On a petite face.
Yes, and it was thicker too.
Was it straight?
It was. So when I was 16, we went to an ENT because I had a serious sinus infection, and he looked at me and was like, I can do something about that. And wanted to do, he was like, I can do something about that too. Like, you know. Yeah.
So he wanted 2 for 1, take care of the humps.
Yeah, he did, exactly.
Wait, let me ask you a question.
Yes.
Did he bring it up, or did you guys bring it up?
He brought it up.
What happened to Christy and her mother is retail medicine at its worst. She went in for a sinus infection, and they got offered a 2-for-1 rhinoplasty. Unbelievable.
What happened? You said no, though. I'm fine with mine.
Yes, well, for one thing, who's going to take care of her?
So the first thing he said when he came out of surgery, there is a piece of cartilage that is a defect.
What was it?
Well, he referred to it as like a deformity, like a flap, and he made it very clear that it was unavoidable.
It's looked like this since that day. It's just progressively gotten worse.
Yeah.
Yes.
Lift your head back, lift your head up. I mean, was it that?
Yes, it's 100% what this is. Yes, it was.
Is that what we're talking about?
Yes.
When you are aggressive with the tip, and most doctors 25, 26 years ago, you remember this?
Yeah.
We're going there and just cutting away cartilage. Chrissy's nose does not have a deformity. Most likely the doctor took too much cartilage out, and that's what caused it to become crooked. And instead of admitting the error in his ways, he just blamed it on her nose and made excuses. The hump, though, was it better?
Yes, the hump was, I mean, it was a hump. I loved the fact that I liked my profile better, you know, so I focused on that. Then fast forward to me becoming a real estate broker. We slap our face on everything.
That's true.
Yes, you know, it's just a constant thing still in the back of my head. I hate my nose.
I can see your beautiful face on a nice bus stop.
Okay.
You actually would look good with that.
Okay.
Listen, if I was going to be on a billboard, of course, you know, looking good, looking, you know, just like this, nice and dapper, it'd have to be on Sunset Strip as you're driving down, all the traffic, everyone's cruising, and then you see my gorgeous picture up there. Would I like that? Yeah, I think I would.
Year 2010. I go to Colombia for only 2 weeks to go see my family. My cousin, she tells me about this great doctor that was having discounted surgery on lipo. I went to see him, and he said, yeah, we can do some lipo on your back. And he said, and you know what? With that fat, we can actually kind of recycle it. We can transfer it to your butt.
Okay.
I didn't tell my husband this. Because I wasn't going there for surgery. It just kind of happened. And I was in love with the results. When my husband saw me, he said, "What did you do? You look different." And I was just smiling, saying, "No, I didn't do nothing. I was just working out." But then, 2014, I started feeling this, felt like pebbles. Sitting down, it was uncomfortable. It pinched me.
Okay.
And that's when I told my husband.
Yeah.
My husband is freaking out. What? But when did you did the fat transfer? You never told me about this. So I go to Colombia and I go see this doctor. He said that it was, in fact, that was silicone. And on the MRI, it's showing it's all over my butt.
What did he tell you?
We had to take it out immediately.
Okay.
He said, "You're lucky. This can kill you."
You don't want to mess with injected silicone. It can cause massive recurrent bumps, lumps called granulomas. When that happens, this could damage the tissue. It can get in your blood supply. It can cause a clot. It can kill you.
I go in surgery about 3 days later.
Okay.
So he's making a big incision, one side to the other.
God, okay.
And then he's taking all the fat.
Removing fat with silicone
From this,
in it.
yeah, right. I come out from surgery, I was shocked. Yeah,
Flat.
He took your buttock away.
completely he removed it. He mutilated me. He said, just wait about 6 months to a year, and you're gonna have to come back and we'll do a reconstruction. I didn't have enough fat, I was very slim. He said, we're gonna have to go with
Implants.
implants.
Okay.
It was horrible. The implants were towards my side.
Yes.
They're not in the middle where they're supposed to be. I didn't see no projection.
Right.
I feel like I'm still deformed. Not only did this change my life physically, but my husband and I are now thinking of separating. He has lost all trust in me, and I don't think he'll ever forgive me for what I did. Right now, I feel very disappointed in myself, feel ashamed and guilty.
So you came in thinking you needed a tummy tuck.
Yeah.
And the truth is he probably didn't do tummy tucks because he hadn't learned how to do that one yet.
He was like, we can take all that fat. And he's like, and you know what I can do? I can put it in your butt.
It was his suggestion.
Yeah, and so every ounce of fat that he took out of me, he stuffed in my butt. Because he didn't want to throw it out because he said it's too much of a hassle to throw out.
Well, it's expensive. You can't just dump it in the trash.
So immediately after I got off the table and he showed me the picture of my butt, I was like, that is terrible. What is that? He goes, oh, it's the swelling. It's going to go down. And then he tells me, now you're going to have to wear a yoga mat.
What do you mean wear a yoga mat? What does that mean?
How do you do that?
How do you wear a yoga mat?
So he told me to get a yoga mat and bring it into the office, and then they cut it, and then you wrap yourself in it. Oh, so that wasn't normal?
No. Asking a patient to wear a compression garment after liposuction surgery is very common. Asking them to wear a yoga mat is kind of insane.
And then he told me, put a book here. Then he tells me, put 2 books on the side of your butt to keep it up.
What books
I
did
hope
you
this
use?
guy lost his license.
Dr. Seuss?
So I would have used a horror novel. This is terrible.
So did the swelling go down? Did anything change?
It got worse.
This is the most preposterous story in regards to medical treatment and surgery that I ever heard of in my entire life.
The second time I went back, he put more fat in my butt.
So you let him do lipo on you again?
I was like, I just want it fixed. And now it looks like an actual heart.